Hi guys, Dr. Kid here. I'm currently a doctor that works at a clinic that specializes in adult ADHD, and in this video I'm going to discuss how to use Bupropion for ADHD and all the things that you need to know before you start this medication. So what is Bupropion? Well, Bupropion is commonly sold under some brand names such as Wellbutrin or Zyban, and it's typically used for patients to help them quit smoking by reducing their cravings for cigarettes. It can also be used to treat depression. It can also be used in a combination with another medication, naltrexone, to help with weight loss. With regards to its use for ADHD, it's a non-stimulant medication and is typically used when a patient cannot tolerate the stimulant medications that are commonly used for ADHD. Generally speaking, patients present to my clinic are usually having issues with executive dysfunction, such as poor attention, concentration, memory, organization, issues with procrastination, and emotional regulation. Typically, the best medications to treat these symptoms are the stimulant medications, and these include medications such as Vyvanse, Adderall, dexamphetamine, Concerta, and Ritalin. However, there are some patients that cannot tolerate these medications due to side effects, or cannot use these medications because they have certain medical conditions. This is where Bupropion may have a role in treating the ADHD. Now, there actually is quite a few non-stimulant medications, so what would lean you towards taking Bupropion as a medication for your ADHD? Well, you may choose Bupropion if you also are a smoker and really want to try and quit smoking, or you have comorbid depression with your ADHD, or you like the idea that the medication may slightly assist with weight loss. So how does it work? Well, in patients with ADHD, the dysfunction is thought to be in an area of the brain known as the prefrontal cortex, which is an area at the front of the brain, and it's responsible for executive functions. The implicated chemicals in this area in ADHD are noradrenaline and dopamine. Bupropion is known to raise the levels of these two chemicals in the brain. By the way guys, if you're liking this content, don't forget to like and subscribe to the channel. It'll help me make more content like this. So what dosage do you use? Well, a large systematic review, which was done by Cochrane in 2017, which is a large review of the literature on a particular topic at a particular time, revealed that all the studies that studied ADHD and Bupropion used long-acting doses of Bupropion between 150 and 450 milligrams a day. So using this information, it's best to start on 150 milligrams a day and increase the medication slowly only if it's needed to improve symptoms more if there's no side effects. So what are the side effects? Well, the most common side effects with Bupropion are insomnia, headache, dry mouth, and nausea. The insomnia can be transient in some cases, and if it's mild for you, you can persist with it for a week, and if it goes away, you can continue the medication. A rarer but more important side effect to be aware of with Bupropion is the increased risk of seizures. In studies that have studied Bupropion, 1 in 1,000 patients taking this medication do experience a seizure. Which leads us on to the contraindications to Bupropion, or who should not take Bupropion. So patients that have a history of seizure or epilepsy should not take Bupropion. Also patients that have a known brain tumor, patients that have had a history of bulimia or anorexia, patients who are abruptly withdrawing from heavy alcohol use or benzodiazepines, and patients that are concurrently taking a medication class known as the monoamine oxidase inhibitors. So in summary, Bupropion is a non-stimulant medication that is typically considered when the patient cannot tolerate the stimulant medications for ADHD. You may consider Bupropion more strongly if you have ADHD and you also are currently smoking and want to quit, or you have ADHD and could currently have depression as well. If you want to learn about other medications that can be used for ADHD, whether they are stimulant or non-stimulant, I'll leave links in the description below. I've made lots of YouTube videos on all those. Don't forget to like and subscribe to the channel, and here's another video on another non-stimulant medication for ADHD if you're interested.